Joining us today to discuss the very formative years that His Highness the Aga Khan was just talking about is Dr. Sweta Shah, AKF's Global Lead for Early Childhood Development. Sweta, thanks so much for making the time to join us and for talking to our supporters today.
Yeah, thanks so much, Khalil. I'm thrilled to be here.
Sweta, can you start by telling us a little bit about your role at AKF?
Sure. So I provide technical and strategic leadership to the organization. That goes everything from technical support to country programs, all the way to coordinating with other AKDN agencies and building partnerships with external partners, including donors.
And Sweta, I mean, you don't come to this role as a rookie. You've got a lot of experience both as a practitioner and as a scholar in this area. Tell us a little bit about uh, your background in early childhood.
Great. Yeah. So I started off really in education, working in developing countries in a lot of humanitarian contexts. I was really doing implementation work, and slowly I started working with young children. But then it just became a real passion that I didn't want to just work. I didn't want to work with all children, but maybe focus on young children. So that's what's led me to this place. And then I also did a PhD to really deepen my knowledge as well in this area. So practitioner and also have dabbled in academia.
Sweta, we've been talking a lot about COVID, and we've been saying that COVID looks like a health crisis, but actually, once you penetrate beyond the first impressions, you realize that it's actually a crisis along so many other dimensions as well. COVID has clearly had a very significant impact on children, even if they're not being infected with the virus. What are some of the big challenges that you're seeing faced by children as a result of COVID? What are some of the barriers? One of our donors, Nuhat Pirani, was asking specifically about some of the barriers now that our young children are facing as they think about at least their educations.
Yeah, so Khalil, this is something we're very concerned about. You're absolutely right. This is not just a health crisis, but we're really concerned because many schools around the world are closed. Many are virtual. When you think about young children, virtual is not really the best in terms of best practice for learning for young children. Our approach at the Aga Khan Foundation and within the Aga Khan Development Network is very much interactive, play-based learning. And so the fact that schools are closed or they're virtual in some places is really concerning to us. We are seeing, though, that we are able to, through this crisis, see real innovations. We know that a number of countries are probably going to have a full year where children won't have access to any sort of education, whether it's virtual or not. And this is extremely concerning to us. So we've taken a number of steps to really address this and to support governments, and in particular to support our communities. One of the things that we've done, innovations, and I'll just share an experience from our program in Kenya, is that we've partnered with Nation Media, and we've actually started a nationwide television program for children, targeting children and their parents. So this is, of course, looking at small children, but it's relevant for older children as well. And these short little shows are storytelling. And so it's fun for families. They can sit around TV and watch someone model what storytelling is about. And so it could be reading a book or telling a story. And what we're hoping to do from that is help parents who are really now in the driver's seat in terms of children's education in many of our countries, to really see what is good storytelling, what is a good conversation, how can you promote literacy, vocabulary development, analysis, critical thinking, some of the really important 21st century skills that are in our program. So that's one example. Some other things that we're doing is using radio. Many of our contexts don't have radio, don't have television. So we try radio. We are also using SMS, WhatsApp, and a bunch of different modalities. But to give you an example of what we're doing with radio, our affiliate organization, the Madrasa Early Childhood Program in Tanzania, is working on, again, short little radio programs that focus on literacy and numeracy skills. And again, these are like usually 10 to 15-minute spots. So it keeps people's attention, but it allows for children and families to get some input. We've done some surveys in Tanzania to look at the impact of this, and we've been really excited to hear that parents are actually engaging with their children more. They're having more conversations, and some of the activities that they hear about on radio, they're actually continuing to practice with their kids at home. So these are all very encouraging types of innovations that I feel that we've made to support this crisis.
Wow, that's very, very exciting to hear, Sweta. It's kind of strikes me as I hear you talk that the educational barriers are one part of this, but the crisis has been disorienting in all kinds of ways for all of us. Presumably,
Yeah.
the psychosocial impacts of all this for children must also be pretty severe. Is that something you're seeing, and are there things that we can do to support that part of the childhood experience as well?
Absolutely. And that's been actually one of the things that we see most. In my experience in working in humanitarian contexts, the stress and psychosocial aspects are really, really difficult, and sometimes even more difficult to manage than access to learning opportunities. So that is an area that we've really, really targeted in our COVID-19 response as the whole Aga Khan Development Network. And I'm pleased to say that, we're forming new partnerships. So in northern Pakistan, we have a new partnership with UNICEF specifically tackling issues of mental health and psychosocial support. We produce guides and practical tips and tools to help families and children to use really fun play activities to promote psychosocial support, to help families and children release stress, and when they do that, that's going to really change their whole approach, and they're actually going to be able to learn better as well. So psychosocial and stress management has been a big area, and I would say, Khalil, not only for our communities but for ourselves as staff as well. So it's been a big emphasis with AKF also overall for our staff as well, because we're kind of going through the same thing that many of our communities are going through.
Well, I mean, it's one thing that, in a sense, binds the whole world along
Mhm.
during COVID. I mean, in a sense, it's been such a disruption for all of us. It's one of those areas where we can somehow feel our interdependence, maybe more viscerally than we have in a long, long time, because it's such a global and universal crisis. And of course, that's going to be the same for the kind of children around the world. Where all of us are confronting our children at home, also maybe dislocated, not being able to go to school, not being able to see peers and friends and relations as they used to before. So, are you worried about the longer term consequences of all of this? I mean, what does this? What does this all suggest for our longer term programming in early childhood, which we know His Highness has emphasized as such a strategic priority for us? Do you think COVID is going to change our long term posture?
So I think actually COVID has changed a lot and is going to change a lot. And I would say not, obviously, there are a lot of negative impacts, which is, children losing all this time in school, using opportunities. But I think there's some silver linings to this as well, that I've been really reflecting on. One is all these innovations that we're now making: use of TV, use of radio, use of WhatsApp, use of SMS. Those are things that we're going to continue utilizing as we move forward, because in some of our most remote geographies, the issue of access is still going to be there. The issue of having teachers who don't have sufficient training and background is still going to be there. So we need to think about innovative approaches to reaching our most rural communities. So some of those actions that we've started, that we came about it because of COVID. We had to be creative, but those are things that we are going to want to keep to some degree as well, even when schools open. Um, so I think that there's a lot. And then the other thing that we've seen is, as an ECD community, we know and we promote parents as really the first and most important teachers for their children. And for so long, we've been, trying to promote more active engagement of parents. And now parents are thrown into it and they're realizing that actually, you know what? Education system does a lot, but we need to step up as well. And we're seeing all over in all of our contexts, and probably in Canada and in the US where I am, including you and me, we have to step up. There's no choice. And so I think another silver lining actually is the amount of the amount that parents are learning through this process about their own role and just empowering them to really be in the driver's seat with their children's education.
That's a really thoughtful and insightful point, Sweta, because in a sense, uh, I think a lot of parents. I mean, I know we felt this. Have all felt kind of inadequate in relation to the new responsibilities we've had for our children when schools have been disrupted and sometimes closed. Do you think we're doing enough to support parents? What can we do? What have we learned about what it takes to support parents to be really caring but effective caregivers for their children, especially at a time like this?
Well, I think the first and most important thing, and this is our approach, whether, even before COVID, but I think it's kind of deepened and strengthened, is that we need to start with where parents are. So parents, they don't know nothing. They know a lot, actually, right? They come with a lot of assets. They have the best intentions for their children. So what we are here to do is to support them, to empower them, to help them see actually that a lot of the things they do in their daily lives are really critical for children. So, for example, when I mentioned storytelling, I mean, that's something that any parent can do, and probably many do, is you can even talk about your own life. And that is learning as well for children because they're learning content, they're learning vocabulary, when you do storytelling, they're learning about how stories are written. So I think we need to start with where parents are. I think parents do, though, need more peer to peer support because parents are also struggling with the stress and the psychosocial challenges. And so we are trying to have more peer to peer conversations. Sometimes parents just need to express the challenges that they're facing with their kids or the stress they're feeling. Sometimes parents want to talk about something else and get their minds off of coronavirus. And so we are doing a lot to bring parents together to facilitate discussions around children's learning, but also sometimes just for them to talk to other people. Because of coronavirus, we are all isolated. Many of us, in many contexts, we all have to social distance. We are not able to socialize with other people in the same way. And as humans, we are social beings and we need that. So parents and supporting parents has been critical to our work. And I would say with this virus, it's even deepened within AKF.
Sweater, you've been at this for a long time. Any surprises for you as you've gone through and watched the way in which either children or the communities where we're working have responded to the crisis in relation to caring for and helping the development of their children?
Yeah, so it's been amazing, actually. I've worked in so many humanitarian contexts as well. And it's interesting that
And sort
when
of
we
by humanitarian, you mean like real crisis situations?
Yes, absolutely. So war, refugee contexts. And what's interesting is that we have in some of our geographies, such as Syria and Afghanistan and northern Uganda, they're in chronic crises as well. And what's been interesting is as we've been working with all of our country programs on changing their modalities for teaching and learning and thinking about different approaches, we found our teams and our communities in these areas to be extremely resilient and flexible. And actually, they've been able to adjust to these changes faster than some of our other country teams who are not used to, are not, they have more stability. So that's been really, I guess when I heard about it, I wasn't shocked by it, but I didn't realize it until I heard it really from the teams. So just remembering that resilience and what you bring with you is, helps you build that resilience. I've also been really happily surprised. I go back to parents and been thrilled and really happily surprised by how we're seeing families really rise up and really take the lead in their children's education and working with school systems to make sure teachers are, that they're providing the best support to teachers and to education staff. Now, we're not expecting parents to be teachers. They are not. Teachers are specialized. They, are professionals, but there's a lot that parents can do to support teachers to enable better learning. And I've been really happily surprised to see how we're seeing families and parents really rise up during this time.
Sweta, earlier we talked about how COVID has got these universal characteristics. In a sense, we've all been confronted in some way or another by needing to think about children at home. You've seen a lot of crisis situations. What's your advice to all the parents out there as they try to contend with what might continue to be months of disruption still in their children's regular routines and schooling?
Yeah, so I think I go back to some of the basics, which is routine and stress management. I think when families are able to have a routine, it would surprise you, but it can be hard to do when, especially if children are home all the time and you're trying to work. I mean, we have very different contexts, whether you're in Canada or whether you're in Afghanistan, of course. But we know that there's a huge burden on parents and families right now. And so I would say create a routine, whatever that routine is. Try your best to keep to that routine. I myself have created multiple routines for my family and have not always kept to them. So it's always a work in progress, and don't beat yourself up if like you can't perfectly fit your routine. But routines do help in making not only families but children feel a sense of stability and calm. And then the other is really critical for parents themselves, is take time out for yourself, for your own mental health and for your own physical health. So, many parents and adults are juggling so much right now, whether maybe they lost their job and they're trying to figure out how to get a new job and earn living, or whether they're working full time and have children at home. But looking after yourself and your physical and your mental health is critical, because if you, as a parent and as an adult in the child's life, are able to be calm and stable, that is going to help that child as well. And children really pick up on parents' emotions and what parents are feeling, even if they don't say it. So keeping ourselves as calm as we can be. There are times when, like, I also, struggle to keep it together. And then I just have to take a breath, away from my kids, take a little breather, maybe take a walk if I can, read a book, and then come back. And then I know I'll be a better parent. So I think self care is really critical. And I would say try your best to keep to routines.
Sweta, that's advice we could all use. Thank you for those nuggets of wisdom. Thank you for all that you are doing. We know from all the research how important the first few years of life are for the entire lifespan. And so, thank you for all you're contributing to help AKF serve these communities who are confronting so many difficulties. And if we can continue to safeguard the life and the environment of the children, even amidst this crisis, hopefully we'll be able to prevent the lifelong consequences being too severe, and maybe even, as you say, find some silver linings that will allow these children to flourish in the years ahead.
Yeah, thanks so much, Khalil.